Dr. Reti, the New Zealand Māori Health Authority is a GoneBurger. The Māori Health Authority was not only a failure in achieving improved health outcomes for Maori, the MHA was also an unnecessary divisive bureaucratic racist cost on the country. The new coalition government was of course, 100% correct to push the legislation to abolish the MHA through Parliament with urgency, along with other urgent policy matters, all within the coalition's 100-day action plan. This urgent political process may not suit certain oversimplified reductive non-binary MPs like the crazy Green Party's trainee wannabe leader Chloe Swarbrick, aka New Zealand's Queen of Crispy Cabbage Word Salad, who would much prefer to unpack every policy into an evidence-based political Lego set. How else could she pretend to justify her huge salary? That's why we attempt to have adult MPs running governments in the opposition, in order to avoid such childish woke game playing, which just wastes time and taxpayers' money. That's why New Zealanders must avoid electing political parties like the crazy New Zealand Greens or lazy Te Pati Maori into government again. They are a costly overhead and serve no useful purpose whatsoever. Thank you Dr. Reti. Geraint, on behalf of WhangareiTim.
This is a simple piece of legislation, and I will conclude with a few simple closing remarks, recognising all the work that the House has put into it over this past 24 hours. This bill lays the foundation for a future health system that is focused on health need. I want to reiterate that I believe we all have the same dream for the health system. We all want to address health inequities. We all want to shorten waiting lists. We all want a workforce that isn't overstretched and that has the right skills to respond effectively to all our diverse populations. This government is totally focused on outcomes. The question we ask about any policy is, will it improve outcomes? Will it mean people get better care? Will it mean people get faster care? Will it mean people get the care that suits their circumstances, including cultural competency? My dream for the health system isn't about bureaucratic structures and endless plans and reports. It's about identifying need and responding to it. Primary and community health care is most people's gateway to the health system. When we get this right, we'll be supporting New Zealanders to stay in good health for longer, wherever they are, whoever they are, and whatever their health needs are. Mr. Speaker, we can choose form or function. I choose function. We can choose activism or actions. I choose actions. We can choose outrage or outcomes. I choose outcomes. I commend this bill to the House.
My question is to the Minister of Health. What steps has he taken to improve the health outcomes for all New Zealanders, including Maori?
Thank you, Mr. Speaker. Mr. Speaker, this afternoon the government passed the Pai Ora Disestablishment of Māori Health Authority Amendment Bill. This transfers Māori Health Authority staff and functions to Health New Zealand and the Ministry of Health. This transfer will retain the expertise needed to drive better health outcomes for Māori and all New Zealanders, and will be done with respect for fellow health professionals. I look forward to identifying other priorities for the health system.
Supplementary. Why did the government move to disestablish the Māori Health Authority?
Mr. Speaker, disestablishment was agreed to by all three governing parties in their coalition agreements and mandated by the results of the 2023 general election, where it was canvassed at length. The disestablishment is a reflection of an approach that struggled to put health needs for all at its forefront and an implementation plan that faced significant challenges from the beginning. This government remains committed to improving Māori health outcomes.
Supplementary.
Dr. Hamish Campbell.
What challenges have arisen from the health reforms of which the Māori Health Authority was part of?
Mr. Speaker, it is not clear to me that the Māori Health Authority was well supported by the previous government, who in my view were distracted by wider structural reforms to other parts of the health system. This distraction is evident from the report today by the Independent Ministerial Advisory Committee, which uncovered a significant number of problems which can be associated with a lack of ministerial oversight and political failure. Health reforms should not have been undertaken in the middle of a pandemic.
What is the government's vision for Māori health?
Thank you, Mr. Speaker. This government is ambitious for the future of Māori health, and this bill signalled the beginning of a different journey, a journey in which we strive to achieve better health outcomes for all New Zealanders, including Māori. This government will ensure the health system is performing after 6 long years of deteriorating health metrics.